Hey guys, this is Taylor with SoCal EMS Training Institute. In this video we're going to talk about the basics of splinting and how to splint. So what is a splint and why do we use it? So if a patient breaks a bone or a joint, we want to immobilize that extremity in order to prevent pain and prevent any more damage, and essentially to get them over to the hospital so they can get x-rays, potentially surgery, depending on how bad the break is. So we have a couple different devices that we use and different types of splints out in the field that we can come across. Before we do that, the first thing I want to do is talk about how to splint a patient. So if I fell and broke my arm right now, my natural instinct is to hold my arm and stop it from moving and kind of compress and immobilize it myself. So depending on what type of patient and what type of break they have, you might actually have them already immobilizing themselves. But while they're doing that, you want to check CPMS before and after every time you splint a patient, okay? So what's cap refill? What's their cap refill? What's their pulse like? Can they feel it? Are they able to move? So you want to check CPMS before and after. A couple different things that we have up here for different types of splints is we have a cardboard splint right here. We have another cardboard splint which actually has padding already on it. We have a SAM splint, which are pretty cool to use, depending on what type of break you have. We have a air splint, so you just pump air into this, and this would splint it in there. And then you also have a vacuum splint. So this would wrap around their arm, leg, and then you actually suck out all the air with a vacuum, and that conforms to the patient's arm or extremity. So that's a vacuum splint. If they had a mid-shaft femur fracture, we would be using a traction splint, which is a whole other video we'll show you guys later. But this would be a traction splint, which is called a Sager. And then, for example, if your patient had a bunch of injuries, for example, you might suspect a hip fracture, femur fracture, spinal injury, well then we're going to put them on a backboard and we're going to splint their whole body by using the backboard. So once we have checked CPMS on that extremity, we're going to measure the splint, we're going to put on the splint. Whenever we splint something, we always want to make sure it has good padding and it has the ability for us to be able to continue to reassess their vital signs. For example, their pulse, so leave a little bit of space in order to check a pulse and good CPMS. You want to use, in order to wrap up different splints, we have what's called Curlex, which is pretty much just gauze in a roll. We also have Coban, which is awesome because it just sticks to itself when you compress it. And there's also like ace bandages and stuff like that as well if you needed to use that. So there's different tools and splints that you have out there. It's up to you of what you want to use, depending on what you have available and what type of splint there is. A lot of splints, and a lot of times you come across patients that have a broken bone or joint. It's going to be kind of like a puzzle and figure out, okay, how do I help this patient without hurting them too much? You may have to use a few tricky ways of getting the splint on and cutting and conforming the splint to wherever their bone is. But you're going to have to do whatever you got to do to get that splint on. Remember that you can always use a pain management, which the best one as an EMT is going to be ice. So once you get on scene, put ice on them. That way it starts to numb and starts to make that extremity feel better. And then the second thing is we always want to splint above and below the injured site. So if I broke my arm, I want to do the joint above and below. So I'd use the wrist, I would splint the wrist, and I'd splint the elbow as well as my whole arm in order to do that. If I broke my ankle, I would splint the foot and then my tib fib as well. So always splint above and below the injured site. If at any time the patient has a really grossly angulated, pretty jacked up arm or leg or extremity, you are able to try to move that into anatomical position without trying to hurt the patient too much, depending on how the patient is doing and what they are saying. You can have one chance in order to move that back to anatomical position. Hey guys, it's Taylor with SoCal EMS Training Institute. In this video we're going to be talking about splinting and actually how to apply a splint. So for example, my patient, Tyler, he broke his arm. So whenever you come across a patient with a broken bone or a joint, we want to figure out what happened, get oral history and everything like that. As you can see, he's already splinting it himself, which is very likely for someone to do, is kind of hold it in place, which is good. So we want to have him continue to do that while we get the splint going. We check CPMS and get an ice pack on him. So if we had an ice pack, let's put that ice pack on the splint or on his extremity wherever it's hurting. Right now we're just going to say that we're going to have a radius ulna, just mid shaft right here. So while he's doing that, I'm going to check CPMS. Okay, so I'm going to get a pulse. I got a good pulse. Okay, I'm going to check good cap refill. Can you wiggle your fingers for me? Good, and then can you squeeze my hands?
Yeah, it hurts
All right, good. You want to be careful with patients. You don't want to have them squeeze too hard or wiggle their toes too hard, depending on what type of break it is. As long as they can move it just a little bit, that's good. And then can you feel that?
Mm-hmm.
Okay, what finger is that?
That's my thumb.
Okay, good. Once I've checked CPMS, that's before. We're going to check it after as well. But we're going to determine what splint we want to use, and we're going to put it on. I always like to help myself and make it easier for myself. If I can choose between a cardboard splint without padding or a cardboard splint with padding, I'm always going to choose the one with padding. That way I don't have to pad it afterwards or before. It's already there. So with this patient, since it's a bone, we want to splint the joint above and below the injured site. So we're going to splint his wrist and his elbow, and we're going to mainly focus on his arm. So with this, what I'm going to do is I'm going to just talk to the patient. Hey, what we're going to do is we're going to put this under you. We're going to conform it to your arm, and it's going to help you make feel better.
Okay, thank you.
So it might hurt him a little bit, but what we can do is just kind of splint this how it is. I'm going to cut with my trauma shears. Good, you can hold it right there. I'm going to cut right here on these circles, so that way it moves up on his elbow. And I'm just going to bend that, so that way it kind of stabilizes his elbow in place. And then from here, what I'm going to do, his wrist is already stabilized, so now we've done our joints above and below. And then from here, I'm just going to wrap it with some Coban, and that way it stabilizes the whole joint and stops it from moving. If you have a partner, your partner might be able to help you. Definitely want to have them try to help you. If you're patient, depending on how much pain they're in, you will have them help you as well too. So we want to leave enough room to where we can feel good CPMS. So right now I am able to feel my pulse as well, still. So again, you want to have that ice pack on his extremity right when you get on scene. That way it at least somewhat numbs his pain. And if you're with a paramedic, depending on how much their pain they are in, they might start thinking about pain control with medication. Not in this video, we won't be going over it, but if we needed to, since it is his arm and he's kind of awkwardly holding it, we can be going over and potentially think about doing a sling and sloth. But right now we're just going to splint this patient's extremity up. We would continue to wrap that. Once that's done, I'm going to ask him how it feels. How's it feel?
It feels a little better, thank you.
Feels good. We're going to check CPMS afterwards. We got a good pulse, good cap refill. Are you able to wiggle your fingers?
Yeah.
And then can you feel that?
Mm-hmm.
Good. Okay, so we're going to document all of that. We are going to transport the patient to the hospital. That way the doctors can get x-rays, potentially surgery, and a long-term cast or whatever they need to do for that patient's arm. So that's the basics of splinting and how to splint a patient's arm. That can be used on their hands, their arms, their upper arms, their legs, feet, extremities, fingers, toes. Pretty much anything on their extremity, we can use pretty much that same basic technique for this patient. So that's the basics of splinting. Thanks, guys.